Babies are normally born without any teeth showing, but below the gums, where they can't be seen, all their teeth, except their wisdom teeth, have already begun to form. Most babies' milk teeth start appearing around the age of 6 months. Normally, it's the bottom front ones first, and then over the next 2 years, the other teeth will follow. Teething can be tough. Gums can be inflamed and sore, and there can be drooling and irritation. Some people imagine that because milk teeth are temporary, losing them doesn't matter. That's not true. Losing milk teeth too soon can affect the development of the adult teeth. Milk teeth are the space holders for adult teeth. So losing them early through decay could lead to closing of that space, resulting in crowded, crooked adult teeth. And milk teeth are also needed for speech, chewing, neuromuscular and jaw development. And they can even affect the height and shape of the face. So it's really important to look after them, especially as their enamel is 50% thinner than an adult's. As your child grows, spaces begin to form between the milk teeth to accommodate the bigger, wider adult teeth below the gum. At around 6 years, their big teeth start to come through. And as they do, the root of the milk tooth is resorbed by the pressure of the adult tooth. When the adult teeth are fully through, and if they are looked after properly, they'll be ready to last a lifetime.
Typically, around 6 months old, the bottom 2 central incisors will begin to erupt, followed by the top 2 central incisors. The lateral incisors will erupt on both sides of the central incisors. The first molars usually erupt around the first birthday, and the canines will follow the first molars. Lastly, the second molars will erupt around the second birthday. Please remember that every child is unique and eruption patterns may be advanced or delayed.
Dental sealants are a preventative treatment performed on children and adults all over the world. It's a thin, protective coating applied to the chewing surfaces of our teeth that most commonly get cavities. Sealants adhere to tooth enamel to fill in the deep pits and grooves that catch food, thus helping prevent cavities before they start. Who is a good candidate for sealants? Anyone can benefit from dental sealants. However, some categories of people may receive added benefits from a sealant treatment. Adults with high-risk teeth. Some people have teeth with naturally deep pits and grooves that are more likely to suffer decay than those with more shallow pits and grooves. Our dental team can help identify these high-risk areas and recommend a sealant to prevent decay. Children. Children's permanent molars begin erupting into their mouths around age 6. At this time, many children may still struggle with maintaining a proper brushing and flossing routine. By placing dental sealants on their molars, we can create a surface that is easier for a child to clean. Special needs patients. Patients with mental or physical challenges can also benefit from sealants. Whether a mental challenge makes consistent oral hygiene hard to manage or a physical challenge makes performing the tasks of brushing and flossing difficult, dental sealants can protect the teeth from cavities on the biting surfaces.
Regular brushing and flossing are the best ways to keep your teeth cavity-free. But there's a quick, inexpensive dental procedure that can help defend your teeth against decay. Dental sealants are thin layers of plastic painted on the chewing surfaces of teeth. Sealants keep harmful bacteria and acids from forming cavities in the rough, uneven surfaces of back teeth, called molars, your chewing teeth. Before applying sealants, the dentist or dental hygienist will clean and dry your molars. The sealant material is then painted on teeth and cured or hardened with a special light. Sealants are for young children and those a little older, but the earlier they are applied, the better. Sealing molars as soon as they come in is the best way to prevent cavities.
What does fluoride actually do? Fluoride is a term often mentioned by dentists. However, many patients may not understand what it is and its benefits to your oral health. Fluoride is a naturally occurring mineral present in the ground. Many minerals are important in aiding the body to grow and function. Fluoride in particular is necessary to build and maintain the strength of our bones and teeth. In fact, since the 1940s, many cities across the US have added small amounts of fluoride into our drinking water to improve the health of our communities. Why do our teeth need fluoride? Today, many people's teeth are under constant attack by cavity-causing bacteria. The strong acids present in foods and drinks like coffee, soda, and fruit juices destroy our tooth enamel. This process of mineral loss is called demineralization. Fluoride can reverse this process through remineralization. It adds minerals back into tooth enamel, making our teeth stronger and more resistant to future acid attacks. What are the benefits of professional fluoride varnish? While fluoridated water has many benefits, it cannot match the impact of a professional fluoride varnish. Professional treatments offer a high concentration of fluoride in a single dose that is both immediate and long-lasting for patients of any age. When applied by your dental professional, an application of fluoride varnish can take less than 1 minute. Your dentist or hygienist simply brushes the varnish onto the teeth, concentrating on any particular problem areas. Due to how quickly the varnish adheres to your teeth, you can rinse and eat most foods immediately after application. However, you may be advised not to brush your teeth or drink hot liquids for a few hours in order to allow the varnish time to set in.
the permanent teeth grew in, the roots of the baby teeth dissolved away. But sometimes permanent teeth don't come in directly under the baby teeth, so the roots of the baby teeth stay strong instead of dissolving away like they should. And then we see something like this, permanent and baby teeth, side by side. This is a time for us to remove the baby teeth. Sometimes, when the permanent teeth are a little out of alignment, we see something like this. Some children just hate to wiggle a tooth to help it come out, and they need our help to remove the tooth. It's usually best to restore damaged baby teeth if the permanent teeth aren't due to come in for a while. But if an X-ray shows that permanent teeth are ready to come in, then it would be better to extract the decayed baby tooth. Sometimes a baby tooth is so damaged that it has to be removed, even though the permanent tooth isn't ready to come in. Space maintainers are then used to hold the teeth in place until the permanent tooth is in.
Maintaining good oral hygiene is one of the most important things you can do for your teeth and gums. When brushing, tilt the bristles at a 45-degree angle towards the gum line and make circular or sweeping motions. To make brushing more effective, only brush 1 or 2 teeth at a time. If plaque is missed, it will release acids and begin to break down the teeth, gums, and bone, so make sure you don't forget to brush the insides of the teeth as well as the chewing surfaces of the teeth. Remember that daily preventative care involves brushing every morning and night for 2 full minutes and flossing.